Hello everyone. Today I'm doing a full breakdown on Jadelle. What it is, how it works, how well it works, and who it's not for, or the contraindications. I also want to clear up something from my last video, my yesterday's video that wasn't explained properly. So let's go step by step. What is a Jadelle? So Jadelle is a contraceptive implant where there is two small soft rods about the size of a matchstick, which is just inserted just under the skin of your upper arm. So it's a long-acting method, meaning once it's in, you don't have to think about contraception every day. It lasts up to 5 years and can be removed anytime you want it out. So Jadelle, it releases a steady low dose of a hormone called levonorgestrel, a progestin, no estrogen involved. It works mainly by stopping ovulation, so no egg is released. And it also thickens your cervical mucus, so sperm can't easily get through. And it thins the lining of your womb. Okay? So this is one of the most effective methods that is available here in Fiji. It's over 99% effective. Once it's in, there's very little room for user error, unlike the pill where you can forget a dose. Now here's what I need to clarify from before. Some of you were told in the past that you couldn't get Jadelle because of your weight, that you didn't meet some target. I got excited sharing that this has changed, but I didn't explain it fully. So the World Health Organization now classifies obesity as category 1 for Jadelle. Yeah. Okay. So meaning obesity category 1 implants, meaning your weight alone should never be used to refuse you the implant or delay giving it to you. It works the same way for you as for anyone else, and you don't need to come back any sooner than any other patient after insertion. Same follow-up schedule for everyone. But I do want to be fully honest with you. Some research suggests that in women with higher body weight or higher BMI, hormone levels from the implant may run slightly lower toward the last year or so of the 5-year lifespan. Because of this, some guidelines suggest that women with a higher BMI may want to talk with a provider about replacing the implant or the Jadelle a little earlier. Not because it stops working suddenly, but just to be safe. So this isn't a reason to avoid Jadelle or a reason to be refused it. It's simply something to discuss together as the years go on. So Jadelle isn't right for everyone. It's not recommended if you have current breast cancer, unexplained vaginal bleeding, even that hasn't been checked yet, or severe liver disease or acute venous thromboembolism. If you have a history of breast cancer with no recurrence in the last 5 years, this needs a proper discussion with your health provider first. Like any method, there can be side effects, and the most common one is a change in your bleeding pattern. Some women, they get irregular spotting, some get lighter periods, some stop having periods altogether. And other possible side effects include headaches, breast tenderness, your mood changes, acne, and sometimes weight changes. And the insertion site reactions like bruising or soreness can happen too, but that usually settles quickly. So that's the full picture on Jadelle, what it is, how it works, how effective it is, who should avoid it, and what side effects to expect. If you've been turned away before because of your weight, go back and ask questions. You deserve proper counseling. Okay, so drop your questions below or go see your nearest health center for more information. Binaka.